right, well, welcome everyone. As I said, my name is Haley Buckner and I'm the Professional Relations Manager for Elevate Oral Care. Thank you all for joining us this evening. Before we begin, I'd like to cover just a few housekeeping items. For those of you remaining online past 50 minutes, your CE certificate will be emailed within hours of the completion of this talk. So be sure to check your spam folder. Everyone is muted, so there's no need to worry about any background noise. We will have time at the end for questions, and you can submit your questions on your webinar dashboard, and they'll be tracked throughout the talk. We have hosted an extensive series of free live CE webinars on many prevention topics. Each of these webinars were recorded and are available with free self-instruction CE at the web address that you can see on the screen, elevateoralcare.com/elevatingcare. Be sure to bookmark this page and return often to see what's new in free CE. Also, if you have a topic that you would like to see covered, please feel free to suggest it by sending an email to info@elevateoralcare.com or by completing the webinar survey that will be sent after the completion of the talk this evening. But for tonight's talk, we have my friend and Elevate's very own Brooke Crouch. Brooke is a dental hygienist who is solving access to care issues through innovation and education. She is passionate about educating patients and colleagues on the latest methods of prevention and recommendations for high-risk patients. Brooke is a published author, while she also provides continuing education through speaking engagements at national conferences and webinars. Brooke's personal journey with Sjogren's syndrome, coupled with her dental hygiene background, has made her a strong advocate for our xerostomia suffering patients. Brooke is a patient advocate, thought leader, and educator on topics pertaining to prevention, public health, xerostomia, dental products, and innovative methods of delivering care. And she is a preventive care consultant for the state of Virginia with Elevate Oral Care. Brooke, take it away.
Awesome. Thank you for that, Haley. And thank you, Elevate, for having me tonight and for this opportunity to share this message with everyone. And thank all of you for joining us tonight on this Tuesday night and taking time out of your busy day to hear all about xerostomia and helping these high-risk patients. So we will get started. I've got a lot of great information that I'm excited to share with everyone. Okay. So just some objectives for tonight and kind of some things that we'll be going over. They're listed there. We're really just going to be doing a lot of conversation and talking around xerostomia. We'll talk a lot about the role that we play as the dental team member, how we can best help these patients that are suffering from xerostomia. We'll look at how we're currently helping those patients, what we're currently recommending. We will look at several different products that are out there that we can be talking to our patients about and recommending and how we can get them in their hands. And we will be talking about pH and buffering capacity of saliva and how that really impacts all of our patients, but particularly our patients that are dealing with low salivary flow. As Haley mentioned, I am a preventive care consultant with Elevate Oral Care. So my disclaimer is here that I do have a financial relationship with Elevate Oral Care. And now let's get into the course. And I've got this slide here that says xerostomia, the constant complaint. And so, is that the constant complaint? Is that something that you're hearing frequently from patients? Where do you practice? Think as we go through this conversation tonight, keep in mind where you practice, who you're seeing. Is this something that your patients are bringing up to you consistently? Or is it something that they aren't really talking to you much about, but maybe you're noticing signs of it? So we'll talk about all of those different things, but it is something that a lot of us that are practicing in any scenario, we tend to hear this complaint from patients a lot. Okay. So why is this my passion and why am I here talking to you about it tonight? Because I became one of these faces when I was diagnosed with Sjogren's in 2016. So that really kind of set me on this path of, or this mission of finding how can I find the best products, really get ahead of the destruction that Sjogren's can cause in the oral cavity. I know from my background as a dental hygienist, the devastation that Sjogren's can can wreak on the oral havoc or on the oral cavity and just all the problems that Sjogren's patients can deal with. So that really put me on a mission to find the best products out there. I knew that my prevention really needed to be strong. I needed to be working really hard and using the best products so that I wasn't finding myself in this cycle of recurrent decay and being in the dental chair as a patient. I didn't want that for myself. So that's what's put me on this mission. That's why this is my passion. This is why I'm here talking to you about it tonight. I will definitely be bringing differing perspectives into our conversation tonight. So I'll be bringing, my hygiene perspective to you. I've been a hygienist for 13 years. I will be bringing a perspective as a mobile dental provider. I've worked in mobile dentistry for a school-based program, but most recently working in a nursing home facility. So I'm bringing that perspective to you tonight. I'll be bringing to you my perspective as a preventive care consultant. I cover the state of Virginia. I'm in offices all the time talking to the dental team. And I hear a lot of feedback for patients that are dealing with dry mouth and they're dealing with xerostomia. So that gives me a different perspective. And then lastly, my patient perspective. And that's really, you guys are going to learn a lot about me, I feel like, in our hour together. I'll be giving you a lot of my patient perspective, which is really, I think, as an oral provider, gives us a different way of looking at what our patients are complaining about and how dry mouth is impacting their life. And I'll probably be drinking a lot of water during the way. So I've got this slide here that says xerostomia mystery revealed. And I say that because xerostomia is mysterious, I feel like. We hear it a lot from patients. We don't really know what to tell them. We hear it very frequently, but it can be confusing on what to recommend, where they can find it. Everybody's so different on what they consider what works for them and what doesn't. So it is a little mysterious, but xerostomia is defined as a reduction or an absence of salivary flow. It could be from a medical condition. It could be from something situational like chemotherapy or radiation. It could be a side effect of a medication. But regardless, if a patient's dealing with low salivary flow, it will affect the quality of their saliva. And we'll talk a bit about that. When we look to, statistics of how common is xerostomia, that's a tricky one. You can see we've got anywhere from 1 in 4 people suffer from xerostomia. Is that common to you? Is that something in your practice? If you look at that statistic, does that seem pretty accurate? I feel like that could be a little low, just depending on the practice. The ADA had also reported that anywhere from 0.9 to 64.8% of the population suffers from xerostomia. So you guys can see that's a huge range. That's because the data is really difficult to collect. It's subjective. We're relying on our patients to tell us that they're dealing with it. So it makes it really hard to get a concrete number of how prevalent it is. But just think about for you and your practice and your patients, how common is it for you and for the patients that you're seeing on a regular basis? And this slide, I'm reviewing here, just reviewing about saliva production here. So just a reminder, it's controlled by the autonomic nervous system. So we can't control it. We can't make our bodies create more saliva. I wish we could. We can't. It's an exocrine fluid secretion and it has a lot of properties. I love this visual though, because you guys can see here, kind of if we look at the breakdown here, 65% of our saliva is made by the submandibular glands. The parotid makes about 20%, and then the rest is the sublingual and minor salivary glands. So that's a great reminder. We're really seeing most of that saliva production done by the submandibular and the parotid glands, and we'll take a closer look at that in a different slide. But that's just really meant to be a good reminder. And when we think about functions of saliva, what's our saliva doing for us? It does a lot, you guys, it does a lot. You can see here from this slide, there's a lot of information there. It's got all those, it's got an antifungal property, it's got food digestion, and that's a good one to really think about. We'll come back and talk about that a little bit more. but your saliva does a lot for you. So it's got that antimicrobial activity. It's really helping with that mechanical cleansing action. So helping remove food debris. It controls your pH, which is really important, and we'll take a closer look at that. It's also important for lubricating the oral cavity. So it helps with that comfort level by having that lubrication. That lubrication also helps preventing mouth sores and things like that. So it's really important for that. And then it's functioning to remineralize and maintain the integrity of our oral mucosa. So it does a lot for us. When we don't have it, you realize how much it does do for us. So it is doing a lot there. It's functioning. It's when it's functioning and you've got plenty of saliva, we don't even have to think about it. But when you don't, you realize how much it's doing for you on a regular basis. So when we think about saliva quality, it's multifactorial. So we aren't just looking at how much saliva do they have in their mouth when we see them or on a regular basis. We're looking at salivary flow rate. We're looking at the pH, we're looking at the buffering capacity, which those two tend to be, go hand in hand, and we're looking at the viscosity. And all of those things are really important. When it comes to flow rate, when I go to the dentist and my hygienist is in my mouth working, my flow rate looks fine because she's in my mouth working, right? So my salivary glands are being stimulated. You wouldn't necessarily know that I have Sjogren's and that I do deal with a dry mouth based off of the clinical exam. So if I didn't report that to her, if it wasn't on my medical history, or we didn't have a conversation about it, she might not even know that I deal with it. And then we may not even have a conversation about my risk or what products I should be using. So it's really important to remember that it's not just about the flow rate. It's got, we're looking at multiple factors when we're looking at the quality of saliva that someone has. Some effects of dry mouth. Dry throat is definitely one. So some effects of dry mouth, burning sensation, bad breath. And I do want to say with that, when we think about patients that feel like they have bad breath, that can be make a patient very self-conscious. So when we're thinking of products we want to recommend for them, and we're keeping that in mind, we want to recommend products that are going to give them a fresh feeling, because feeling like you have bad breath, and that may be something that they do need to deal with, that can make someone feel really self-conscious. So we want to make product recommendations that can target some of that as well. With dry mouth, we know those patients are at increased risk for tooth decay or gum disease. They do tend to deal with a decreased or altered sense of taste. Dry mouth patients tend to see recurrent mouth infections such as oral candidiasis. And if you remember from the slide we were just looking at, our saliva does have an antifungal property to it. So if we're not producing quality saliva, we're going to be much more prone to things like oral candidiasis. And then difficulty eating, speaking, or swallowing. So really the list goes on and on, but those are just some of the effects we see from dry mouth. Okay. So I told you guys you're going to get to know me a little bit better tonight. That's my mouth. And when it comes to diagnosing xerostomia, it's very difficult. Sometimes it's easy, right? Sometimes it's easy. Our mirror is stuck to the buccal mucosa. We know that they have a dry mouth, but sometimes it's not that easy. And it really does come down to, going through their medical history. We're going to look at all the different causes, and we'll talk about all of that. You might be able to diagnose it from your oral exam. They may report it to you, so they may tell you that they're dealing with it, and you can diagnose it that way. There is a simple procedure called celometry, which can be done in the office, kind of measures flow rate. And then pH testing will help measure the quality. So pH testing is not going to diagnose xerostomia. It will just help give you a better idea, and the patient a better idea of where their pH tends to hover, so that they can use products that can target that. The reason I've put this picture and put myself out here for you guys with my mouth is because when I actually took this picture, I had gone to see my rheumatologist. So I see a rheumatologist every 3 to 6 months. And the first couple of years of my diagnosis, he just was not 100% sure that I had primary Sjogren's. But every time I see him, he always has a medical student with him. And one day I was there and he asked to look at my mouth and he was like, lift up your tongue. And I did. And he brought his medical student over and was like, I want you to look at this. So what he's looking at here, and hopefully my pointer will work. He's looking at the sublingual caruncle. And he's also, if you guys can see these little bumps under my tongue, little white bumps under there. He was saying that that's where some of the salivary glands are just minorly blocked. And my sublingual caruncle, you might not be able to see it from the picture, but I've got some of those little bumps on that as well, and it's kind of swollen. So he was telling his resident, he's like, this is classic Sjogren's. This is very typical to see of a Sjogren's patient for their tongue to kind of have this appearance. So of course, I came home and took a picture because I'm a hygienist and I wanted to see what he was talking about. And now I'm sharing it with you. But I share it with you because it can be a good reminder that when you're doing that oral cancer exam, you're lifting the patient's tongue out, you're looking underneath, when you're checking that surface, look to see if you see anything that would indicate there are any blocked, sublingual salivary glands there. And so what's the cause? We really want to figure out what the cause is. We're not going to be able to fix the cause, right? We can't fix any of the things I've got listed there. But by understanding the cause, we can help advise our patients better. So we're going to get into each one of these. There could be other causes. I mean, xerostomia is a constant complaint, right? So we hear it a lot of times, and it may not fall under any of these categories, but this is where we're going to focus our time tonight, is with those 4 categories. So we're going to start with age and some of the aging population. And again, just kind of keep in mind who your patients are. Do you see a lot of older patients? Do you work in a nursing home facility, or do you have nursing home or assisted living patients coming to you? We need to think about the aging population. So the life expectancy has increased from 68 to about 81 for women and 76 for men. So, we know people are living longer. As of 2018, the population is expected to climb to 80 million. So that's a lot. And then in 2034, it's anticipated that for the first time ever in the US, older Americans will outnumber children. So if you're not seeing a lot of older adults in your practice right now, you probably will be. And we want to make sure that you're ready for that and that you know how to help prevent disease in this population, because with this population, prevention is the key. And the bottom line is that most older adults suffer from dry mouth, which means they are high risk. So when we're thinking about our older population and the aging population, it's very common when it comes to root caries. I know root caries with that population, I don't have to tell you guys. It's very common. It's really a result of multiple things. Low salivary flow is a contributor. Very difficult to manage. Very difficult to manage. And really treatment and management is going to depend on where the lesion is, but silver diamine fluoride can be a great option for those surfaces and for those patients. So this isn't an X-ray we ever want to see, right? This is not a radiograph we ever want to see, but the reality is we do see it very frequently, especially if you work with older adults, especially if you've ever worked with the nursing home population. This is not an uncommon radiograph to see. This is what we have to prevent. So this is where we want to be ahead of this game. With root caries and with the older population, decay concerns, we know they have a high incidence of caries, especially our xerostomia patients. Root caries are the major thing, and with that, we are just really trying to get ahead of the game. And prevent recurrent decay as well, of course. And that's where I said that silver diamine fluoride can be a great option. It's not only a great option, it can be a game changer for that population. For the patient and for you as the provider. It's very difficult from a provider standpoint to constantly, be restoring and re-restoring and re-restoring. It's frustrating for both parties. So this is where silver diamine fluoride isn't just an option, it's a game changer. And I'm not going to get into this too much. Hopefully, if you are on this webinar, you are familiar with Advantage Arrest and you know these bottles. Hopefully you have them in the office. But I have it in here because if you are an office that sees older adults and you're not using silver diamine fluoride or you haven't thought about it for them, I have it there just to, encourage you to think about how that could help that population. And if you don't have Advantage Arrest in the office, you could always contact your PCC. We can certainly look at that for you because that's a great option. So that's kind of the age cause and kind of the age population and how that is impacted with xerostomia. So now we're going to look at medication. So the average ambulatory older person is taking on average about 5 medications on a daily basis. So that doesn't have to be an older person, you guys. I mean, how many of your patients, how many of us take 5 medications on a daily basis some days? That can be anyone. The average nursing home patient is taking about 7 different medications daily. And I don't know about you guys, but if you do treat the nursing home population or assisted living, I think that's a low estimate. Most of them are on many more medications than just 7, but that's a low estimate. Most of those medications have a side effect of dry mouth. So, we've got that compounding factor there. They're older and they're on medications. Maybe they're on multiple medications that have a side effect of xerostomia. The most common culprits, I don't know if any of these medications look familiar to you guys. I know I'm on Claritin here in Virginia on a daily basis. When it comes to xerostomia, there are actually over 80 medications whose number one side effect is xerostomia and dry mouth. That's a lot. These are just some of the most common culprits: antihistamines, antidepressants, ADHD medications, anticholinergics, antihypertensives, antipsychotics, anti-Parkinson's, diuretics, and sedatives. Does that sound familiar to you guys? Do any of your patients ever present on any of these medications? Only every day, right? And many of them more than just one of those. So keep that in mind when you're thinking about that for those patients and you're looking at that medical history. They're probably taking a medication whose side effect is xerostomia. And it just highlights this here a little bit with antidepressants. So antidepressants, a lot of our patients are taking them for various reasons. There's actually a lot of medical conditions where you're put on an antidepressant, like, whether it be migraines, whatever it might be, but a lot of our patients take antidepressants, and that can be starting at a young age. And that can also be our older patients. Late life depression is a real problem. So I highlight that particular category before we move on, just to remind us of some of the major side effects with antidepressants. And so if you have a patient on them, we want to make sure that we've got the best preventive measures for them and that they're using the best products. Breathing issues. We've talked about age. We just covered the medication cause for dry mouth, and now we're going to look at some breathing issues briefly. So we've got chronic obstructive sleep disorder, and this was so timely because I just took a course this weekend from Catherine Gilliam on sleep issues and the dental professionals being more involved with screening, and she really covered a lot in that course. And it was great to have that refresher because a lot of us are starting to talk to patients about sleep issues and sleep disorders and how that's affecting their breathing and how it could impact their life. So it was a great reminder. But our sleep apnea patients, they are going to deal with drier tissue. Our COPD or chronic pneumonia patients, they're going to deal with drier tissue. And then anyone that's using oxygen is going to have a drier mouth, and their tissue is going to be more dry. We know with sleep apnea that's also linked to hypertension, cognitive impairment, heart disease, and strokes. We definitely want to be talking to our patients about that, and if they're dealing with anything like that. With breathing disorders too, it's estimated that at least 25 million Americans, so like 1 in 5, suffer from sleep apnea. It's also estimated that about 80% of the moderate to severe obstructive sleep apnea cases go undiagnosed. So we want to be having these conversations with them. We want to make proper recommendations and make screening and talking to them about that. We also know that currently more than 25 million Americans have asthma. I hear this very frequently in my pediatric practices. So a lot of times it's kids that are dealing with asthma as well. They're using inhalers on a regular basis, which can dry their tissue out, and that could increase their risk just because they're using their inhaler on a regular basis. But good to remember that even our patients with asthma are probably dealing with some drier tissue. And approximately 14.8% of Americans have COPD. And according to Healthy People of 2020, there's about 12 million that have yet to be diagnosed with COPD. So that's a pretty alarming rate. COPD is actually the 4th leading cause of death in the United States. These patients are going to be on oxygen. So we're going to want to make recommendations for them because they can't come off their oxygen. They can't come off of any of these things, right? They can't come off, we can't change their age. We can't take them off their medications. We can't have them not use the breathing devices they need. So we need to do our part to have those conversations with them and make recommendations. So we're going to get into some autoimmune stuff now, Sjogren's, but before we get into Sjogren's, I just wanted to talk to you for a minute, excuse me, about autoimmune. So autoimmune is also very tricky. It is, a lot of people go undiagnosed for a long time with autoimmune disorders before they're actually diagnosed. Sjogren's is just one of more than 80 diseases. So you get 80 diseases, that's a lot. That's a lot of autoimmune disorders that are out there. Nearly 4% of the US population suffers from an autoimmune disorder. And for some, we don't know the reason, but there is an increased prevalence of autoimmune disorders. So if you're not seeing a lot of patients with them now, you very well may be seeing more patients reporting autoimmune disorders. And once you're diagnosed with one autoimmune disorder, you are typically diagnosed with more than just one. It puts you have a higher risk of having more than just one autoimmune disorder diagnosed. So keep that on your radar. It's good to know that. I think that it's estimated that about $86 billion a year is spent in healthcare for autoimmune diseases. So it's on the rise. Just be in the know about that for your patients as you're looking at their medical history. So when we're thinking about autoimmune disease, we're thinking about that, who is our highest risk? Well, that's us, ladies. That's me. That's you. We are the highest risk for autoimmune disorders, not just Sjogren's, but any autoimmune disorders. Autoimmune disorders tend to affect women 3 times more likely than men. So much so that the Office of Research on Women's Health at the National Institute of Health has named autoimmunity as a major women's health issue. So keep that in your mind. When you're going through a medical history and someone sits down and tells you that they have, multiple sclerosis or rheumatoid arthritis or something like that, they may have more than just one autoimmune disorder. So let's talk about Sjogren's. It's an autoimmune disorder. I kind of led us into that. Treatment is aimed at relief of symptoms. So there's no cure. There's no cure for any autoimmune disorder. About 3.1 million adults have Sjogren's. It can affect any age, but it's common between 45 and 55, although that's just a range. I was not in that range. A lot of people I talk to are not in that range. So it's just a range, but certainly diagnosed much younger and much older. Affects women 10 times more likely than men. So there's that kind of mimicking what we just heard about the fact that women are at much higher risk for autoimmune disorders. About half of the patients that have rheumatoid arthritis also have another connective tissue disorder like lupus. So I mentioned that, if you have someone sit down and they tell you they have rheumatoid arthritis, I would start talking to them about, do you deal with any dry mouth? Have you ever been tested for Sjogren's? Has your doctor ever talked to you about it? You can certainly open the door to have the conversation. Sjogren's is not usually the primary diagnosis, but if it is, it can be much more destructive. I told you guys about that. My doctor was not convinced that mine was primary. It took a couple years to rule some other things out, but that is what mine is. And these patients have a higher occurrence of lymphoma. So they're typically seeing their rheumatologist and their primary care for blood work on a very regular basis to monitor for that. So Sjogren's syndrome, April was actually Sjogren's Awareness Month. So if you didn't know that April was Sjogren's Awareness Month, it was. We just barely missed it with this webinar. But what you're looking for here, what you would typically expect. So Sjogren's, with it being an autoimmune disorder, with autoimmune disorders, your body's attacking its own cells in some way. With Sjogren's, it's attacking all of your moisture producing glands. So basically anything that produces moisture in your body, that is what Sjogren's is attacking. So you can expect that you're going to see dry mouth, mouth sores. Of course, we talked about dental decay, caries, dry or peeling lips, dry or burning throat, which you guys might be able to hear from me, a change in taste or smell, or a bad taste in the mouth. And I do want to stop there for a second, because just like a lot of autoimmune disorders and like a lot of diseases in general, you can have a flare. And a Sjogren's flare is something that a lot of people deal with. And when they're dealing with the flare, symptoms are usually much more increased. So I've had that happen to me as well. and I've dealt with that bad taste in my mouth because of a Sjogren's flare, and it is awful. I mean, it is awful. Everything tastes bad. You can't get away from it. And so keeping that in mind when you're making product recommendations, you want to recommend things that taste good, because these patients do tend to deal with a bad taste in their mouth on a frequent basis. So it's good to just highlight that. Dry eyes or nose, swollen, painful parotid or salivary glands, heartburn and reflux. So this is interesting. If you think about it, I mentioned if we go back to the beginning, when we looked at all the properties of our saliva, part of the properties of the digestive tract is kind of help break down food. That's what our saliva helps us do. It helps us break down our food. It helps us digest that. Well, if you're not producing saliva or you're not producing quality saliva, you can't do that so well. Not to mention the fact that your digestive tract may be dry from your Sjogren's. So these patients do deal with a lot of heartburn, a lot of reflux, a lot of regurgitation. So that is going to increase their risk, and that's going to, make sure that we want to make sure that we're talking to them about that and recommending the best things for them to use at home. And then joint pain is another syndrome or another sign of Sjogren's syndrome. Not really sure why. That's the other thing with autoimmune disorders. There's a lot of things that doctors just can't tell you the why behind it. But joint pain is something that most people with Sjogren's would report is a problem. So if we look to the extraoral side effects, thankfully there's not many, right? Because we're dealing with enough intraoral side effects, but swollen parotid glands, lymphadenopathy, and dry, painful nasal passages. And so this is kind of reinforcing what we looked at earlier. We remember that the submandibular, the parotid glands, is what's producing the majority of our saliva. So when those glands are working really hard to produce saliva and they just can't, they hurt. So lymphadenopathy is very common. Having a lot of discomfort is very, very common. I've even woken up with my parotid glands swollen to about the size of a quarter. And that's not fun either. Thankfully, I knew what was probably going on. So I put a warm compress on that parotid gland until the swelling went down. And it's not something I deal with regularly. But if you do have a patient telling you that they deal with that on a frequent basis, I would recommend that they talk to their doctor, because they could have a blockage or something going on there. But it's not uncommon to see a swollen parotid gland and have a patient talk to you about that. So I'm going to just briefly touch on saliva substitutes. I've got them both listed there. I'm going to actually go ahead and advance to the next slide, because what I want to show you is we've got saliva substitutes as an option. I've got two of the most common ones listed here. What I'm showing you though is the side effects. And so I mentioned saliva substitutes so that you guys know it's an option. I've never used them before. My doctor has never felt like that was a route he wanted me to go down. He knows I've got my prevention game going. He knows I'm a hygienist. So, and he also knows that he's seen a lot of patients that he's put on saliva substitutes deal with some pretty severe side effects. So he's not one that really recommends them. I do get asked about them very frequently. So it's really up to the doctor and what they feel is best for the patient. I can just say from a patient perspective, it's not a road that I've been down, but it exists and it's an option. So going on to, reminding about medical histories. I hope that you can see so far why medical histories are so important. They are so important. Think about your setting. Where do you work? How does that apply for you? When I worked in mobile dentistry, medical histories were a little chaotic. There's always a lot going on in a mobile setting, but it's always super important to get a good medical history every single time. Every single time. See what medications they're taking. Now we've talked about medications, so hopefully that's even more on your radar to have a conversation with them. They may think that they're just taking an allergy medicine because it's seasonal and it's Virginia and allergies are crazy, but they may not realize how dry it might be making their mouth, which then puts them at risk. So they could be a patient that needs to be on certain products just during allergy season. You talk to them about how that medication could be drying out their mouth and what that means for their mouth. And then just look for any possible risk factors. Like I said, if you see someone that sits down and tells you they have an autoimmune disorder, I would talk to them about dry mouth and see if they're dealing with any side effects of that. And then, of course, medical history is in the same fact. We talked about situational dry mouth and talking about chemo and radiation. If a patient reports on their medical history that they're going through treatment for any kind of cancer, it doesn't have to be head and neck, cancer. It can be any kind of cancer. A lot of cancer treatments cause dry mouth. So that is another, you're reinforcing the need for that thorough medical history every single time. And then, of course, with the nursing home patients, we want to make sure we're getting a good medical history, because you guys might be seeing nursing home patients or assisted living patients in your practice. That medical history is really important for them. And so how do we fit in for these patients? We do a lot more than what that picture is showing, right? I mean, we have a major role with these patients. We're there to be their educator. We really need to educate them on, it's not just dry mouth that they don't do anything about. It actually is increasing your risk because you're not able to buffer against the bacteria and the acid attacks that you're exposed to on a daily basis. We need to educate them. We need to talk to them about what they need. We need to then advise them on that. We need to tell them what they need. We need to figure out with them what works for them and what's going to be the best protocol for them. And we need to advocate for them. We need to be there. We need to advocate for their needs and their health, and we need to be their researcher. They come to us and they think we know everything, right? They'll always ask us about different products that are out there, and a lot of times we don't know, and that's okay. We don't know, but we need to research and find out what's out there and what can be helpful for these patients. You guys are doing that now by joining the webinar. We're kind of learning together and how we can help these patients. And so how are we currently helping our patients? I can tell you guys, dry mouth to us as a dental professional is probably what dry eye was to my eye doctor. So that was the first complaint. I kept telling my eye doctor over and over and over how bad my eyes were, how dry they were. I was a contact wearer though, and I get it. Like, he has to hear that complaint all the time. But that was actually the first symptom of my Sjogren's, and I really can't wear contacts any longer. So dry mouth to us is like what dry eye is to our eye colleagues. So are we listening to them? I mean, I love my eye doctor, and he was listening as best as he could. But our patients, if you've got a patient that's continually telling you, my mouth is so dry, my mouth is so dry, and you don't see anything in the medical history that would tell you why, we need to listen to that a little bit more and investigate that a little bit more. We're dental professionals. We ask a lot of questions. We just need to investigate that a little bit more. Are we making recommendations for them based off of what we think is causing their dry mouth? And then, are we sending them down this aisle? This is an old school aisle. I say it's old school just because it's an old school, or it's an old picture, but are we sending them down this aisle? Because that aisle is daunting for people. And a lot of the things we're going to talk about aren't even down that aisle. So we're going to revamp maybe how we're helping these patients currently. And then just a reminder, how are they treating their dry mouth now? This is a very common way that people are dealing with their dry mouth now. They may be sucking on hard candies that have sugar. They may be drinking sugary beverages. So just remember, if a patient tells you that they sometimes deal with dry mouth, but they don't really do much for it, I would ask them if they ever use hard candies. And if they do, they are increasing their risk. So our critical role as a dental team, I hope that I've helped you better understand the effects of xerostomia, but we need to understand the effects of xerostomia. We need to recommend shorter recalls based off of their risk assessment. So dry mouth patients, especially dry mouth patients like myself, where it's from an autoimmune disorder, that's not going to improve. I would be someone that should be on a shorter recall. And then make proper recommendations for them, because they need more than just the brushing 2 times a day and flossing. We need to give them more. They need more than that instruction. And so we're going to take a look here at pH and buffering capacity. So I learned about this I did the Saliva Chronicles with Ann Guion. She talked about these pH and buffering capacity strips. So are we currently talking to patients about pH? Are we testing their pH and their buffering capacity? pH and buffering capacity tend to go hand in hand, but pH, of course, is the actual pH of their mouth. Buffering capacity is going to be their ability for the saliva to buffer against those acid attacks. So are we talking to them about this? I think it's safe to assume that someone who has xerostomia probably has a low pH. And what I think is so funny about this, I got these strips. I was super excited to get them, tried them. You can see my strip there in the picture. It's actually not too bad. But I had my husband try one because we're dental professionals, right? We try everything out on our family. And he used one of these and it didn't even turn colors. It didn't even change. And I was like, there's something wrong with that strip. Do another one. And he did. And it barely changed again. And I'm sitting there completely like floored. I was just stumped. And then I was like, oh my goodness, it's your reflux. My husband's a long-term acid reflux sufferer. And it didn't even dawn on me. I mean, it should have. I know it should have. But it didn't. I mean, I have him on several products that I use, but I don't have him on my full regimen because it didn't dawn on me how high his risk was until I saw this strip. And it can be powerful. And these strips, you can get them, you can get any strips you want anywhere. They're very inexpensive, but they can be a great thing to start to talk to your patients about to help educate them so that they can better see. I mean, when I saw that, I was like, we've got to do more than what we're doing. And he was on board to do more than what he was doing. So it can be great to educate your patients, but also build compliance. All right, so we're going to talk about some products. When it comes to products, you guys, there are so many products out there. There's no way that I could know them all, that we could ever know them all. What we do need to do though, is we need to make sure our products are safe that we're recommending. So you need to read your labels. You need to know the pH of the products you recommend, know the ingredients and understand the ingredients, know your patient's needs. And lastly, and most importantly, I think is make it easy for them. Make it as easy as possible as you can for them so that they can actually use what you're telling them they need to use. And before we get into our actual products, I just want to give one more reminder about xylitol. It couldn't be a dry mouth webinar if we didn't talk about xylitol and just refresh our memories on why it's so great in our products. It stimulates salivation. It's working on the S mutans. Bottom line is, remember we said saliva production was an autonomic nervous system function, so we can't control it. Xylitol's got that sweet taste, it's got that refreshing effect, so it's the stimulus to the brain like, hi, this tastes great, we want to do something about this. And then it helps increase saliva production and kind of increase that pH. It gets everything going. So xylitol is wonderful, and it's a great ingredient to have in our products. Before we get into the products, because we're about to get into them, I'm going to give one more disclaimer that I said I was going to give you guys a lot of different perspectives in our conversation together tonight, and I am. So now you're going to get into the patient perspective and from a patient perspective, what my recommendations are. I said there are hundreds of products out there. I couldn't possibly have tried them all, and I can tell you guys I've spent a lot of money in these last 6 years since my diagnosis, a lot of money and a lot of time in the products that I use. So these are the products I use based off of several factors, which I'll talk about. But before we get into them, I always get asked, why didn't you talk about this? And why didn't you talk about that? And it's because this is my patient perspective, and this is what I use on a regular basis. A 5,000 parts per million toothpaste, absolutely. Absolutely. Any of your patients that are dealing with xerostomia, even if it's situational, they should be on a 5,000 parts per million toothpaste because we know they're high risk. They should be using that morning and night. And ideally that would be dispensed by the dental office because we know that's going to increase patient compliance. We really, at a bare minimum, need to have them on a prescription toothpaste. I will always be on one. And my husband will always be on one. A water flosser. So this is a water pick. I couldn't live without this thing either. Everything I'm talking to you guys about, I probably couldn't live without, but my water flosser especially. So we've got it there, great for dexterity, effective for food particle. But what I'm telling you from a patient perspective, I mentioned that one of the functions of saliva is to help remove food debris. It is very difficult for someone that doesn't produce quality saliva to remove food debris. You guys would be shocked. So I keep a lot of food in between my teeth after I eat, and regardless of my brushing and even my flossing, the quality of my saliva does not move the plaque and the debris around. Without my water flosser, that stuff would probably still sit in between my teeth. So it is a wonderful thing for me to use. It's something I use multiple times a day. Every time I eat, if I've got it with me, I travel with it. I always have it with me. And another thing is that you can put products in your water flosser. So I mentioned the whole Sjogren's flares and how that happens. When I've had that happen to me before, I have had some of the worst cases of mucositis that I could ever imagine. Again, that's my patient perspective. And it's a very, very painful condition to deal with. And I've dealt with it sometimes 2 to 3 weeks at a time. And when that happens, sometimes the only thing I can really stand to use is my water flosser. It's very soothing. I can put it on the lowest setting, and it can be a really great option for when someone's in a flare. So can't say enough about that and how helpful that is for these patients. So another great thing I wouldn't be able to live without is our all-day spray. We talked about xylitol. We talked about its importance in products. There's 44% xylitol in this spray. So even though it's a spray, it's actually got a mucoadhesive gel to it. So it's a spray, but it's a thicker spray, which allows for that higher retention. This is an amazing product. It can be used morning, night, whenever you want to use it. You can keep it with you all the time. So this is a great option. Right now, our all-day line consists of our spray, but exciting news, this summer, we will be launching a gel. So stay tuned for that, because I hope that what you guys are gonna see from what I'm going through with the product recommendations is that I'm giving you very different delivery methods of, of prevention. I'm giving you very different delivery methods, so that, because not one size fits all. And so we want to see varying different delivery methods. So we'll have the all-day spray and now the gel, which will complement that very well. Basic bites. So these are another thing I learned about on the Saliva Chronicles with Anne. These are awesome. You can see here they are sugar-free chews. You use them twice a day. They're really kind of helping to support that acid-base balance. They do contain arginine bicarbonate and calcium carbonate. They can be purchased online. Here's what I'll tell you about basic bites. Obviously, they're not going to be used. They're not going to be for everyone. If your patient's older and they cannot chew and swallow well, this isn't going to be a good fit. And that's where making the right recommendations based off your patient's needs comes in. If it's an older patient and they can't chew and swallow well and you're concerned, I wouldn't recommend basic bites. But these are great. With basic bites, you're not going to get that immediate relief. Okay, so it's not like using a spray or a gel where you're going to get that immediate relief. These, you have to use them for weeks, multiple weeks before you start to notice. And I do notice that after using them multiple weeks, that I did seem to have a little bit more increased saliva flow. So that can be a great option for patients that it's an appropriate recommendation for. Someone like myself, or that whoever you think that might be a good recommendation for. It's good to know about that. Closis. Closis has been around for a really long time. You guys are probably familiar with Closis. This is a great product. I'm highlighting their silver. This is the one that I use. When I use their mouthwash, this is the one that I use. It's really come in helpful for me in those times where I've had those mucositis flares. The mouthwash has been a lifesaver in those instances. And I've even put this through a water pick before, so this can be a great option. This is also a really good option in addition to like a 5,000 parts per million for your patients that are dealing with chemo and radiation. This can be a good recommendation for those patients also. And of course, Closis, you can get that over the counter or online. Same thing with Basic Bites, you can only get them online. And then with our all-day spray, I forgot to mention that with our all-day spray, you can get that on Amazon.com, or your dental office may have that as well. We'll have that on Walmart.com. And then with our 5,000 parts per million toothpaste, our Fluoramax 5000, that's going to be through your dental office. And so Xylamelts. This is another amazing product that I use every single day. These are great. They're great for during sleep. They've got this adhering disc technology. So if you can see on that picture, the kind of like tan colored side, that's the self-adhering disc part. So that's the part that actually sticks to your gum tissue. The rest is kind of a slow release xylitol. So it's a great way at nighttime when you're not able to, you're not really drinking, you're not using other products. This can be a great thing to use at night. People do ask me a lot about that. They're a little hesitant to sleep in them. And I'm here. I've survived. I use them every single night. I've never choked on them. I do like to put them in the roof of my mouth as opposed to on the buccal mucosa like the package says, but that's just me. I put 2 in every single night and find that they're very helpful. So that can be a great, and those you have to get online. So you can order those on Amazon. And then clear nasal spray. So I love clear nasal spray because if you remember, we talked about the fact that these patients are dealing with dry nasal passages as well. So this is a great recommendation for someone that comes in and talks to you about dry mouth. We should recommend this nasal spray. It's incredibly helpful for those patients. So it's also got xylitol and saline in that spray. Can't really say enough about that. It's just it's a great product. It's a great different delivery method, right? So, and you can get that online and in stores. And then I've also got here TheraBreath. So I mentioned that, bad breath is something that a lot of patients that deal with xerostomia, they are very self-conscious about, and it's a reality. I mean, the bacteria is there. There's just the environment's right to not have the best breath. So TheraBreath is a product. This is their oral rinse. They're really targeting, it does contain xylitol, it's alcohol free. They're really targeting the halitosis with their products. And I use this, I love this, very refreshing. So this can be a great option for your patients as well. And that can be bought over the counter. I just saw it in Walgreens today. So you can get that really anywhere. And then the world of gum and lozenges. So there's 1,000 things out there. 1,000 things are out there. I've got, these things listed here. These are the things that I use. I've got ice cubes there because this is a great gum choice. I chew gum pretty much all day. This is a great gum choice. Xylitol is the #1 ingredient in the ice cubes gum. It's very minty. It's very refreshing. The flavor lasts for a really long time. And it's really easy for patients to use and to get their hands on. This is in every single store, every grocery store, you can find ice cubes anywhere. And we know it's sugar-free, so that can be a great option for them. But really in the world of gum and lozenges, you guys, there's tons of things out there. Those are just the ones that I recommend, and that's my patient perspective for gum and lozenges. And then many other things. So like I said, there are so many things out there. We could probably talk for hours about all the things that are out there. You guys could tell me what you know of. There's oral probiotics. The doctor just last week was talking to me about laser therapy. I'm showing you here the Vutia device. This is actually a wearable device for dry mouth. You can find information on their website, vutia.com, but basically with this device, you wear that apparatus, you can see the water bottles behind it, you wear a little earpiece, which you can see in the picture. The earpiece is super comfortable. I have one of these. And then the tube comes down across your face. You can thread it in between your premolars, and it allows for a constant moisture to be released into the mouth. It does just do water. So it's not providing any medicaments or anything. It's water that's in there, but it's just focusing on moisture. So, and the list goes on, really, the list goes on. So those are just some things that are out there if you want to look into them. The Vutia device is targeted a little bit more towards your really severe patients, head and neck cancer patients, and you can purchase from their website. And then a product alone isn't the only answer. So I hope you can see that I try to give you a broad recommendation of varying products and delivery methods out there. Humidifiers for sure, if you're someone that deals with xerostomia or situational xerostomia or allergies, a good humidifier is a definite. Sipping on water, you don't really want to be guzzling water all day. That can thin your saliva a bit, so just sipping on water. Good lip products, shorter recalls. I can't really stress the shorter recalls enough. And then lastly, it's a team approach. It's a team approach. It is not just the hygienist's responsibility to have this conversation with their patient. It's not just the assistant who spends a lot of time with the patient in the operatory. It's not just the assistant's job. It's not just the dentist's job, but it involves the front desk too. I mean, it's all of our jobs. It's a team approach. these patients dealing with dry mouth are usually very frustrated. They've spent a lot of time, they've spent a lot of money, they may or may not be getting a lot of relief. So it's important to work together to know what to recommend so that if your patient calls and gets your front desk and has a question about that swollen parotid gland, maybe they know what to recommend because you've taken this CE and you can tell them. Or if a patient calls and says they have dry mouth, what could they use? The front desk might be able to answer that question. Or I've had, I get emails from patients with Sjogren's all the time, and I had one that had called and tried to make an appointment at a new dental office and told the front desk that she had Sjogren's, and the front desk had no idea what she was talking about and thought that she was trying to make an appointment for a child. And what do you think happened? That patient didn't make the appointment. They emailed me and they didn't go to the dentist. And so they're not getting the care that they need. And that started at the front desk. So it's a team approach. We have to work together to help these patients and set the expectations appropriately. Not one product I told you about is going to be the answer. Not one product is going to give them so much relief that they don't have to use anything ever again. It is really a combination of things and patience and being there for them. So now it's time for questions. And I thank you guys for your time. Thank you for letting me share all of that about xerostomia and my journey and my mission that I'm on and how I can better help more patients.
Awesome job, Brooke. Thank you so much. And yes, we do have some great questions that came in, so we appreciate you taking some time here for questions. And we are at the top of the hour here, so if you have stayed on this long, you will get your CE credit automatically emailed out. So if you have to jump off, that's totally fine and understandable. But Brooke is gracious enough to give us a little bit more of her time and answer some of the questions this evening. So I'm going to kick it off here with the first one, and it says, in your opinion and experience, can dry mouth in more advanced cases like Sjogren's be managed to a point where a patient can be considered low risk or having no caries in 24 months?
That would be surprising to me. That would be, I guess if that patient were using like xylitol on kind of a more regimented basis, like if it was a little bit more of a protocol of what they were on and what they were using, and I would want to be monitoring their pH and their buffering capacity as well, because without that information, how do we know, their risk? I mean, we want to go by their caries and like what we're seeing, with our oral exam, but I also think it's important to know what their pH is looking like. So I suppose it would be possible, but I'd want a little bit more information and evidence to support that.
Okay, great, thanks. And speaking about testing pH, is pH testing a billable procedure?
I don't think so. But it takes like 2 seconds. Like they just put it under their tongue. And if you did it, if you're doing a pre-rinse, you want to try to get them to do like a pH test before the pre-rinse. So you just put a strip under your tongue and let it sit in that saliva for like 10, probably not even 10 seconds. And then you could have them do their pre-rinse, and then you could be looking at the strip to see what it said. And that would be a great time in the appointment because that way it's not taking up a lot of your time because it's not a billable service.
Sure, okay. But obviously lots of great information gathered from that.
Yeah.
Okay, great. Another question here. Nursing home staff have little incentive or desire to provide oral care. What can they do, or can the individual do easily to treat or kind of fend off dry mouth?
That's tricky. Yeah, I definitely know what you're saying. I've seen that myself. There's my timer. I've seen that myself. It really comes down to having the best products that they can. And that's where sometimes the things like the Xylamelts or something like that can be a great option. I mean, I know that a lot of times the nursing homes, they just don't have the time to brush the residents' teeth. And I've been in there as a dental provider, and they work so hard. I can't ever imagine when I've seen how much they're tasked with. I understand, but it's very hard, and a lot of those patients have dexterity issues. So arming them with the best things we can. So giving the patient the patient, an electric toothbrush to try to help with the dexterity, and giving them something like Xylomelts, which adheres right to the tissue. So we don't have to worry about choking and trying to get that exposure to xylitol. Really, it's going to come down to the xylitol exposure, I think, in that instance.
Okay, great. Very good. Thank you. Going back to pH now here, specifically when it comes to product, you mentioned that it's a good idea to know the pH of the products that you do recommend. So how do we find the pH of products, and what current products have a pH that is really ideal for dry mouth patients?
Sure. So that's a great question. So a lot of times it'll be advertised somewhere on the product packaging what the pH is. If you don't see it, you can always contact the company. You can contact customer service, and you can try to get to someone that can get that answer for you. You want to see a neutral pH. We certainly don't want to see a low pH in a product because these patients already have a low pH. So we want to see a good neutral pH. So that's the best way to, if you can't find it on their packaging, then I would contact the company and try to get to like a customer service and tell them you've got a question about the pH of their ingredients. And you can usually get someone on the phone that will give you that information.
Agreed. Awesome. Okay, great. Thank you.
Mhm.
And then we talked a bit about xylitol here. What do you know about erythritol? Is it as good as xylitol?
Sure. So, yeah, I can't give you a lot of information. I think that that xylitol is going to be the best. Xylitol is where, what I've researched most. So I would tell you that I can't really answer you fully. I go by, like I said, with my research, that xylitol is the best. But I know a lot of products do have erythritol in it. I just haven't done a lot of research around erythritol specifically.
Okay, great. But then going back to xylitol here, can my dry mouth patients get too much xylitol? Are there any contraindications?
Sure. So they're not going to get too much xylitol. The biggest thing with xylitol is going to be, is it going to irritate their stomach? And you really have to go patient by patient with that. So I mentioned that I use a lot of xylitol, right? I mentioned I use the Xylomelts. I use a 5,000 parts per million with xylitol. I use spray, my all-day spray. I get a lot of xylitol, and I've not had any stomach issues, but I know what to look for with that. So I would kind of ease your patient into it a little bit. So if let's say it's like the all-day spray, you might talk to them about use it once or twice a day and see how you tolerate it. Or if it's a Xylomelt, maybe putting one in and seeing how you do. It's going to be very patient dependent, and everybody's very different. But what you're looking for is any kind of GI issues. That's going to be your only concern. And then remember, xylitol is toxic to pets. So I know most of us on this call know that, but I'm a dog lover, and just it's always good to remember that xylitol we want to make sure we keep away from our pets.
Absolutely. Good reminder.
Didn't get that.
Okay, another question here. Do calcium phosphate products work to help prevent dry mouth, treat or prevent decay from dry mouth as well?
Mm, excuse me, sorry. So calcium phosphate products are going to be, I feel like I have not seen where they are quite as effective with dry mouth. But honestly, I haven't done a lot of research on calcium phosphate products for dry mouth. So I'm a little hesitant to answer that one too deeply, only because most of my research, I'm always doing that around mostly xylitol and not necessarily comparing with the calcium phosphate. But we could probably get that answer to you. If we flag that question, Haley, that would be one I would love to get back to someone.
Okay, great. Okay, it looks like we have one more here to kind of wrap it up. What do you think of probiotics in general? Would you say they're helpful?
Yeah, so I actually have just started researching probiotics a little bit more. I do think that they're helpful. I haven't implemented them yet in my kind of protocol, but I mentioned them at the end because they are something that I'm looking into. Patient feedback when I'm talking to different people that deal with xerostomia, like when I give these webinars are great because when people will ask questions, then that gives me something to go look into a little bit more. And it actually came up on another webinar I did, and it's on my radar to incorporate. So I do think that it's helpful. I just can't recommend one specifically right now.
Okay, perfect. Great. Well, those are our questions for this evening, Brooke. So thank you again for just a wonderful presentation. It's really interesting to get all your different perspectives coming into play from being, oral health expert yourself as well as the patient perspective. So thank you so much for sharing all of that. And thank you to all of you that joined us and spent your Tuesday evening with us. We really appreciate it. And just a reminder again that to our guests, your CE certificate will be emailed automatically within an hour or two. So be sure to check your spam folder if you don't find it right away. And then also be sure to follow us on Facebook and Instagram for links to new free CE events. We've got some exciting ones planned here in the future. And then the link on the screen here will give you access to our archived webinars, including this evening's webinar, which should be accessible in just a few short weeks. So please share this link with any of your staff and colleagues. And then finally, on our Elevate Oral Care website, you will find buttons to request an informative CE eligible staff meeting for your office. Education on the latest evidence in oral health prevention is what we do here at Elevate Oral Care, and we would be honored to meet with you and your team and help you best serve your patients. So thank you all again. Stay safe and have a wonderful rest of your week.
Thank you.